patient didn't mention about it to me, sir.
How could I expect the patients to tell you everything they observed, Neeraj? It's a duty to pull the words out of the myth. You know what? Meet me in my clinic tomorrow, right?
Yes, sir. I'll come there. Hello, how are you?
I've not been really good, doctor. Just a few minutes since I've had my dinner. It was some pasta and sauce, I think. But I don't know, my stomach's not been good. I've been vomiting a few times since then. Should I worry too much?
I think it should be just basic food poisoning. Just take a little bit of Gelusil before you go to bed, okay? And come by the clinic tomorrow. Is that okay?
Sure, doctor.
Okay. Take care.
Thank you.
What? At what time? I'll call you.
It's actually not my fault because the patient didn't mention about it to me. You know what? Meet me in my clinic tomorrow, right?
Not a good day, huh, Nathan?
Not really, Chief. Hits you hard the first time you lose a patient, doesn't it?
Sure does. What do you want to talk about?
Guy calls in the evening, says he has a bit of stomach ache. So I suspected of the usual food poisoning. So I suggested hygiene, and then I came to know that the very same night he passed.
What did he have to have caused food poisoning?
I remember him telling about some five-day-old pasta that he had in the fridge. But death because of that doesn't make sense, Chief.
Did you speak with the duty doctors? Did they report anything unusual?
I actually wanted to talk about that. The blood reports show that this could be microvascular steatosis.
You mean liver failure?
Yeah, fat buildup in the liver. But why would there be liver dysfunction in food poisoning?
Maybe we're missing something.
No, look at the blood report. The urea and creatinine are normal. The hemogram seems normal. While blood glucose shows hypoglycemia and also hyperammonemia, which has nothing to do with us, but the liver function is.
What did you say about the blood sugar?
Well, it's low. He's got hypoglycemia. What does that matter?
Well, it does matter because in the 1700s there was an important case. It was called as the Jamaican vomiting sickness. Normally, food poisoning is not accompanied by liver failure, but in the 1700s, the ackee tree was transported to Jamaica by the British, and the consumption of the ackee fruit caused food poisoning amongst the workers who were also diagnosed with hypoglycemia, hyperammonemia, and fat buildup in the liver, the same symptoms as Vishesh.
Wait, how did it cause food poisoning with hypoglycemia?
Well, years later, they found that a substance called hypoglycin causes that, but we're talking about pasta here. There's no hypoglycin in that. Did you bring the test and was the samples?
Yes. Yeah, they did some basic tests. It's on my phone. Okay, Chief, if this is what it is, do you mean to say that the pasta he consumed should have contained something similar to hypoglycemia?
Yeah, I should think so.
I don't see anything abnormal here. It says Bacillus cereus, but what does that have to do with liver dysfunction and everything?
Well, I suppose that makes sense because that's what causes normal food poisoning. But there should be a missing link. I mean, we're missing something in this case.
What do you think it is?
What about Salicylate?
What?
Salicylate, the toxin. I mean, certain strains of Bacillus cereus release Salicylate.
Yeah, I think I remember. It has to do with the potassium addict, right?
Exactly. Look at this. Salicylate is an ionophore and it pumps potassium into the cell, thus preventing the use of glucose and fats, hence hypoglycemia. The mitochondria swells gradually and bursts, causing fatty deposition in the liver. The immune system responds by vasoconstriction of the blood vessels, which in turn causes kidney failure, releasing glutamate and ammonia that causes swelling of the brain and eventually death.
Wait, is Salicylate enough to cause death overnight?
You're right. Salicylate is toxic, but it isn't toxic that much to have caused death overnight. There's something we missed all along.
Then?
The missing piece in this case does not come from the pasta, it's the Gelusil that he recommended.
The Gelusil?
Yeah. Remember the Jamaican case that I told you about? 20 years after that, a similar case of food poisoning occurred with the same symptoms of hypoglycemia, hypoammonemia, and fatty liver. But this time, it was because of aspirin overdosing.
Does that mean?
Yeah. Gelusil. Its main constituent is Bismuth Salicylate, which is commonly called as
Aspirin.
Yeah, we missed it all along.
Salicylate and aspirin had caused dual blockage of the liver, hence resulting in death of the patient overnight.
It all makes sense now.
It does. Vishesh, a 19-year-old student living on his own, should have made pasta that was a few days old. Generally, such foods contain a bacteria called Bacillus cereus, but unfortunately, in the case of him, the dangerous strains of Bacillus cereus were found in his pasta. These Bacillus cereus also produced a toxin called salicylate, which also he consumed. This blocks the liver functions. So in 30 minutes, he should have felt a slight discomfort in his stomach. As time passed away, he thought it should have gotten better, but it didn't. It only got worse. His stomach should have felt upset, and then, after feeling really uncomfortable, he should have called you. When you suggested him to drink Gelusil before going to bed, he should have drank almost a bottle of Gelusil. Now, Gelusil contains aspirin. Salicylate and aspirin both are blockades of the liver. Both together should have blocked the liver functions. When he went to sleep, obviously, since he consumed aspirin, it should have gotten only worse and worse. After feeling really uncomfortable, he should have passed out in his room. From there, he should have been taken to the hospital. Since there was no liver available to be transported within the night, Vishesh should have died within the night. This is not a normal case. We don't see such patients every day, but when we see them, many times we fail to see that it is abnormal. You know, the first time I lost a patient, I couldn't explain how awful I felt that day. He died from a complication that occurs around in 1 in a lakh people, difficult to diagnose, just shows normal symptoms. I couldn't help but think, why didn't I think of every possible diagnosis? What could have I done to not lose him? It's been years since then, but you just never come out of it. You just think you stop thinking about it, but it just leaves a deep scar within you forever. Keep yourself stable, Nathan. There are thousands of patients there. We can't stop. We can't afford to stop. But there's one thing we can do. We can make sure to treat them all well, taking each one as a first patient. There's a long way to go.